Health Policy Research Group, University of Nigeria, Nsukka, Enugu Campus held its annual Project Policy Dialogue in Abuja, tagged Protect Urban School Children's Health, PUSCH.
That this research group, we went through all of the relevant policies, cover to cover, page to page, in order to find, the evidence available and everything. So you can see that even the designers of the legislations we have also made provision for that linkage and that relationship between schools and primary health care. Now, look at the first one. That every person, institution, service, agency, organization, and body responsible for the care and protection of children shall conform with the standards established by the appropriate authorities, particularly in the areas of safety, health, and welfare. What that means is that any school that doesn't have in place some provisions to cater for quality health of a child is going against the law.
The two-day event attracted healthcare professionals and experts from across the country, with focus on healthcare and health rights of school-aged children.
Okay, so finally we have biological ownership of children. So children not living with their some children not living with their biological parents face discriminatory care approach. This group of children usually sometimes rely on goodwill of neighbors or significant others in order to seek health care. Someone in Oslo says there was a case of a guardian who took a child to a herbalist. Eventually the child nearly died. The real parents found out and were very angry, asking why the child was taken to the hospital.
Other focal points included a recap of a River State policy dialogue, feedback on the impact, new research findings, and deliberations.
Support for the Health Policy Research Group of University of Nigeria, Nsukka, under the PUSCH project, which is protecting the health of school-age children project, was based on respect for data and evidence. And in our initial engagements early in 2023, when they introduced this project to me in the first few weeks of my serving, I was alarmed. Now we have numerous child health policies. We have the Child's Rights Act of 2003, which are the frameworks under which we aim to protect the health and the well-being of children in Nigeria. But something stood out, and that was the fact that we've paid enormous attention to the health of children under the age of 5 and adolescents, and of course those above the age of 18. 70% of our child population in Nigeria belong to the age category between the ages of 5 and 17 years. And so when we interrogated the available health policies in a dialogue that was held in River State in August 2024, we found out, of course, we included children in this dialogue because we felt that their voices needed to be lent weighed into the conversation. We found out that a lot of the policies are there, beautiful policies, but the translation to implementation has been the problem. There have been a lot of blurred lines between ministries of responsibility, earmarking of responsibility, and who takes the burden of financing, and that's where collaboration comes in. So at that point, the dialogue involved a cross-section of participants from Ministry of Health, Ministry of Education, Ministry of Women Affairs, Justice, and even Social Welfare and Rehabilitation, just so that we could identify a clear pathway for how we can address school children's health in our country. And so, growing from that state-level policy dialogue, we are now at the point of a national dialogue where we interface with colleagues, other stakeholders. The religious institutions are also here represented, civil society, children from various backgrounds are also part of this dialogue conversation. course, the media, so that we can use the evidence that we have gathered from the research that was done, quantitative research, interviews with people, school students, school personnel, to find out those gaps in the provision of school health services, so that we can actually go beyond talking to crafting policy that is implementable, feasible, and actionable for various states in the country, so that 70% of our child population in this country will no longer be left behind in the discourse on health and well-being. And we believe that schools are a focal point, and health should be a driver of this process.